host for today on Here All Issues Resolved YouTube channel. We go through a lot of look beautiful related issues as we grow up, but little do we realize that it's our hair that's our crowning glory. Our hair symbolizes health and personality. Gorgeous and healthy hair is an instant confidence boost. To guide us on how to take care of our crowning glory, that is our hair, we have with us an expert dermatologist, Dr. Gaurang Krishna. He is a consultant hair transplant surgeon at MedLinks Clinic, New Delhi. He has a rich experience in the field of hair transplant and has conducted over 4,000 hair transplants, consistently awarded as the best hair transplant surgeon by Times of India. There are n number of awards that he has been awarded with. To mention one is he has been awarded with the Best Hair Transplant Surgeon Award in Delhi NCR in 2015. Many more to follow, definitely. It's a pleasure to have you, Dr. Gaurang Krishna, to have a luminary like you and to discuss hairs and the issues related to hairs. Welcome on this session.
Thank you so much, Sanyukta. It's a pleasure to be here with you. Thank you.
So, Doctor, we all, are so concerned with our hairs, and we all know as a fact that we do shed hairs on a regular basis. But then we don't know, Doctor, what's normal and when to be concerned. Please shed some light over it.
So as you rightly said, losing some hair every day is normal, and the number that is considered normal is 100. But that is for a person who has a healthy, full hair growth. So if he or she loses 100 hair under, that's normal. But most of us anyways have some hair issues. We are born with, let's say, 1 lakh hair follicles. But once we reach 30 or 40 years of age, that number goes down. So nowadays we consider that if a person is consistently losing 50 to 70 hair or more in a day, either they are thick or thin, it's a matter of concern. And not just loss. If we feel that the hair volume is going down considerably year after year, so that's also a matter of concern, and that's where a person should see. If he or she is concerned about their hair, then they should see an expert.
Right. And is there a difference between hair loss or hair fall? Because sometimes we say our hair is falling, sometimes we use the term hair loss. Is there a difference?
There's a huge difference. So any kind of hair shedding, when you actually see like hair shedding and falling, that's hair fall, which may or may not lead to long-term thinning or long-term volume loss. Hair loss, on the other hand, is reduction in hair volume, which could be because of an uncontrolled hair fall, or which also can happen with gradual hair thinning. So where a person does not see abnormal hair fall, but year after year, the hair volume reduces. So that's hair loss. And that is what we are more concerned about. Hair fall is normal and it comes back unless it is too much. But hair loss, hair thinning, that needs immediate medical attention.
Right. Having said so, now we would like to understand what are the general causes responsible for hair loss, doctor?
So if there are so many things that causes hair loss. The most common that we'll be focusing on is androgenic alopecia, or patterned hair loss, or genetic hair loss, or hormonal hair loss that we see around us. Traditionally, it happened in men. So the baldness as men is androgenic alopecia, but now we are seeing a lot of ladies also, which is termed as female pattern hair loss, and that is also male hormone driven. So ladies with PCOD or a strong family history of hair thinning can also get affected by that. So androgenic alopecia or hormonal or genetic hair loss is one of the most common causes. Second common cause that we are seeing in the last 3 years is post-COVID hair fall or post-COVID hair loss, which is a severe hair shedding, more than 300 hair in a day, 3 months after COVID. So that is another very, very common cause. Earlier also we were seeing it like after post-dengue, post any kind of fever, but COVID has taken it to a new level and people are really shedding a lot. People who did not have hair issues in the past, but post-COVID, their hair loss has started, and that goes on even after a year or so after COVID. Alopecia areata, which is an autoimmune problem, which causes coin-like bald patches on the scalp, beard, etc. That's another very common cause of hair loss, hair fall, which is seen in 1 to 2% of the general population. Then lifestyle, your diet, people who have a very improper diet, improper sleep cycle, or what we call it lifestyle-related hair fall and hair loss. That's also we are seeing it very, very commonly, particularly in metros, where there is a fast-paced lifestyle, stressful life. There we are seeing a lot of lifestyle-related hair loss.
Okay, so there can be n number of things responsible for hair loss. And as you said, doctor, that lifestyle also plays a very important role in healthy hair or hair loss if it's not in good shape. I would also like to understand many people, because they are aware that if they are losing hairs, which is not normal, then maybe they are, deficient on certain micronutrients, etc. So they go buy over-the-counter supplements and start popping them in. So is this okay habit, good habit, or is it going to harm us?
Okay. So, see, if you have any kind of hair fall or hair loss, it is good to first get a diagnosis, because as we said, there are so many causes, different causes of hair loss and hair fall, and thus treatments are different. So let's say a treatment for alopecia areata is not suitable for treatment for androgenic alopecia, for example. A treatment for a hair shaft disorder will not help a person who has genetic hair loss, so or the pattern hormonal hair loss. So first of all, we have to have a diagnosis. But having said that, if you have seen like people generally see suddenly seasonal increase of hair shedding, so these over-the-counter supplements do help to a certain extent, because nutrition does play a role in hair health and in hair shedding. So supplements which have biotin, multivitamins, zinc, selenium, omega-3, these have some benefit, but we can't depend on them. Regarding harm, well, excess of anything good may be harmful. So many a times these multivitamin supplements have very high supra dose of vitamins, which are way beyond the recommended daily allowance, which is fine to be used till a certain extent, but overuse may also cause problems. For example, heavy use of biotin, which is one of the most commonly used hair supplement, can tamper with your thyroid functions, can tamper with your thyroid reports if you ever get them. So these things, should be taken into account when you are taking these over-the-counter pills.
Right. So diagnosis is important, and only a qualified dermatologist can help you with that. So don't go for anything which can harm you more. Just go consult a qualified dermatologist is the bottom line. Now, doctor, as you mentioned that, the causes may be different in men and women. Let's talk about them one by one. Let's talk about men first. They may have pattern baldness, it could be due to genetic, etc. We would like you to elaborate them. And of course, about also the treatment options available for them.
Yeah. So see, genetic hair loss is by far the most common cause of hair loss in men, by far. And that is what causes baldness in, men, even boys for that matter now. And, something that I should tell the audience is that a new thing has been explained that's called pediatric male pattern hair loss. So kids as young as 10, 11 years old are also suffering from genetic hair loss. So there is no doubt about it that the common baldness of men has a genetic background, and 90% of our patients, they do report a positive family history, means either from their mother's family or their father's family, there are people who are affected by similar issues. So 90% people do have a family history. However, that's not the only factor. Most of the times, male pattern hair loss is an interplay of genetic and lifestyle factors. So you have the balding gene, but that gets manifested, that gives you more hair loss if your lifestyle is not balanced. For example, sleep, diet, overall stress, etc. The treatment are aplenty. So I'll divide the treatment into non-surgical and surgical. So first of all, non-surgical, because that's the more important one, because that what prevents baldness from setting in. So when a male notices that he's losing hair volume, he should start medical treatment under the guidance of a dermatologist. The options are minoxidil. So again, here also I'll divide into hormonal and non-hormonal treatment. Hormonal treatment is more important because it is more effective. So these we call them DHT blockers: finasteride, dutasteride, saw palmetto. These are the DHT blockers that are used. Saw palmetto we don't use anymore because of certain reasons. The ones which are used are finasteride and dutasteride, and out of that, finasteride is FDA approved. But these are not over the counter. These are not to be taken like a supplement. These are proper allopathic medicines. and should be taken only under a dermatologist supervision. But this forms the cornerstone of male hormone hair loss treatment. Second is non-hormonal, and that is where we have so many options. The most used, the oldest, and most trusted is minoxidil. Anything non-hormonal, anything non-hormonal is not super effective in itself, but these are good add-ons. So minoxidil. Second is low-level laser therapy. A few years back, we used to call patients to the clinic for this, but now very good devices are available which a patient can use at home. And these are recently been FDA approved also, some of the devices. Again, not magical, but they have certain role. Then there are newer things like Redensil. A lot of social media promotion is being done for Redensil. Again, not magical, not as good as it has been promoted to be, but it is a good add-on to our main treatments. Newer peptides like Procapil, Anagain, these are also very good options. Then there are clinic-based treatments like PRP. PRP is one of the most popular clinic-based treatments for hair loss. It stands for platelet-rich plasma, in which patients' blood is taken out, which is centrifuged in a machine at a proper setting, and we extract platelets. We activate these platelets and then inject it back on the patient's scalp, which stimulates the hair root and makes the hair thicker and reduces the hair fall. Then things like mesotherapy, where vitamins and antioxidants are injected. Experimental treatments like nanofat, which is considered to be a rich source of stem cells, that is also being tried with reasonable success in male pattern hair loss. After that, there are home treatments. So home treatments like using onion juice or onion oil, castor oil, methi, the Indian spice called curry patta. These things, garlic, ginger, anything which gives a bit of irritation, a bit of itching on the scalp, does promote blood flow on the hair along the hair roots and may promote hair growth. So if somebody says that home treatments are completely useless, that's not true. They are not super useful. It's not that if we just apply onion juice every day, we are going to grow hair. But these are good things that you can do at home to stimulate hair growth along with your main medical treatment. So this is non-surgical, which is done when you start having hair thinning and you prevent baldness from setting in. If baldness has set in or if the hairline has receded, then we want to grow hair on that area to cover those spots. So let's say my hairline has receded, my first three fingers are bald, and I want to grow hair there. Then medicines are not there. There is nothing in the world as of now that can grow a hair root. So in those cases, we do a hair transplant. That's a surgical treatment for baldness, wherein roots from the back of the scalp, which are the permanent roots, beard, and the body hair are taken and placed on the balding areas, and they grow and cover the scalp effectively. But it's a minor surgical procedure. And third things are wigs or hair patches or hair skins, which are basically a prosthesis, artificial thing that you use on the head. Everybody knows what a wig is. So that is like as a last resort when medicines do not work, a hair transplant cannot be done, or a person does not want a surgical treatment, then a hair wig is used. So these are the various non-surgical, surgical, and non-medical treatment options for male pattern hair loss.
Right. We also understand, doctor, that stress can lead to hair loss because nowadays stress is really taking a toll on us, and we also know that hair fall can lead to stress. Yes. A lot of body shaming is associated with hair loss or balding, etc. We have seen in many Indian movies. Yes. Where they have shown the plight of people who have these kinds of issues. We have also very recently, not very recently, but this year only witnessed on a very reputed platform like Academy Awards, where a body shaming statement was given, again associated with hair loss. So what I'm trying to understand or ask you is that despite having so many treatment options, even if nothing works out, do as a doctor you also try to counsel the person who's going through the whole hair loss thing and understand or try them to understand that your mental health is equally important, and it's okay if at all nothing is happening and hair is you are losing hair. So how important a consultation or a mental guidance also works.
So thank you for asking this question, actually, because this is a very pertinent problem. Because and dealing with hair loss patients, male and female, since last 13, 14 years, I've seen that, you know, to somebody who does not have hair loss issues, it's nothing. A hair loss, no, nothing, does not matter, why are you even bothered? But a person who's actually suffering from hair loss and has experienced, as you rightly said, sometimes even body shaming, and so our society has become in that way where vanity has become very important. They really lose their confidence. So as a doctor, my role is not limited to just give them hair loss treatment options. My role very much is counseling them, in helping them in tackling, holding their hand through their hair loss journey. And I make it a point, I tell it to all my particularly young patients, even teenagers, 18, 19 years old, are coming to me and with actually severe hair loss and hugely concerned and bothered with their hair loss. So I tell them that, see, again, first of all, you are not alone. Almost every third boy has some kind of a hair loss issue sooner or later in his life. So it's not something unique that you are facing. And after all, it's just hair loss. Thank God it was not your lung, your heart, or your kidney that is suffering. It's just hair. It's something which is purely external. And you should embrace it. Embrace it that, see, along with all the good genes that you got, there are some problematic genes also, unfortunately, that we get sometimes. So we should embrace it, and we should understand there's nothing wrong that you did. Apart from sometimes people do have a very bad lifestyle, but apart from that, there's nothing wrong that you did, a wrong medicine that you took, anything like that. It's a matter of chance, and it is rectifiable. If it is so important for you, it is rectifiable. We have all the various options to help you in this journey. If at all nothing works, even then it's fine. You see so successful people like Jason Statham, The Rock, Dwayne Johnson, Jeff Bezos. These are people who have baldness, but they look so very good. Though it is the crowning glory, it is an important part, but there is so much more to your personality, like your overall physique, your attitude, your career. So there are so many other things that make you much more attractive than what hair does for you. So you should focus on them as well, improve them, and maybe hair does, and maybe hair is no more very important for you. If you are bothered about it so much as at this point, maybe 5 years down the line, you would laugh at this, that why was I even bothered? I look so good. I'm carrying off the bald look so very well. So yes, counseling is a part, but a person who is bothered about his hair loss, there are treatment options. So there's no reason to worry really. And yeah, most of my patients, they listen to me and they are happy. Sometimes I do refer them for proper expert counselors for their better psychological health, because mental health, as you rightly said, is as important, in my opinion, more important than their hair.
That was really very inspiring what you said, doctor. And having said that, would you still like to tell people, if you are shedding hairs which is not normal, then you should go and consult a qualified dermatologist, because an underlying medical condition could be there. It's just not about your hairs. Maybe you are deficient on something, etc. So again, it's always advisable to go and consult the right person.
Absolutely, you should make the right diagnosis so that you don't miss anything. Like, for example, thyroid issues can cause hair loss. There are many other severe problems inside that's happening. Even your kidney issues any kind of health issues can cause hair loss. And many times we diagnose other problems, thyroid, for example, where the person has come to us complaining of hair loss. So yes, you should not ignore any organ failing. And human hair, though it's a dead organ, but inside where it is growing, it's very much live hair root.
True.
So a problem there can be a sign of an internal problem. And otherwise also, when let's say hair is not, it's just vanity, but it's vanity after all. So if it's happening and if there is a way to treat, then why not?
Exactly. And as you very rightly said, there are so many options available. And in case nothing is working out, then wigs are there. I think they are they are also a great boon for us. Now, doctor, as you have expertise in hair transplant, you have done 4,000 plus hair transplant surgeries. We would like you to elaborate hair transplant. Who can go for it? How you do it? How painless or easy as a procedure it is, and how benefiting it can be for the people.
See, hair transplant has really become, come out as a boon and has become one of the most frequently performed aesthetic surgeries in the world as of now. It was liposuction a few years back, but now I think it would be hair transplant by far, because it has become so popular. The techniques have become so refined and result oriented and safe, and people are so much more aware about it. In last 7 to 8 years, the numbers have increased like anything. So hair transplant basically is a minor surgical procedure, which is done totally under local anesthesia, in which we take out hair from the permanent root. The permanent root means a root which is not affected by male or female pattern hair loss, which by and large, as a dictum, are hair on the back of your head, above the ears, your beard and body hair. So these are the hair which, if just imagine anyone bald, you will, the picture that comes, a person who is bald from here, but still has hair here, still has hair on the beard, because these areas are not affected by hormonal or genetic hair loss. So in hair transplant, we pick up these roots. It's not plucking out the hair. We actually make a small puncture in the skin and take out the root from inside the skin and then replant it on the bald areas. Again, it's not a hair that is plugged and stuck. That's not hair transplant. A root is taken out and it is placed inside the bald skin, and then this root produces a hair and keeps producing hair. And that is why the results of a hair transplant are by and large very, very long lasting, because these hair are totally immune to hormonal hair thinning. So minor surgical procedure done under local anesthesia, typically 5 to 6 hour procedure, and you get your hair roots back. It takes 6 months to 1 year to get the old look back. Because first 3 months is the lag period. We plant the roots. First 3 months, we do not see much happening. Then the hair starts to grow and gradually it gains length. Gradually, all the transplanted roots, they grow and it changes your look. One thing that's important is that a hair transplant is not a hair to hair replacement. It doesn't give us all the hair that we lost. We lose 40, 50,000 hair. But when we do a transplant, we transplant 10,000 to 15,000 hair. But it is done in a way that once it grows, it looks very, very natural, because we focus more on the hairline, we focus more on the back portions. So, we strategize, we plant our hair roots in a way that even less looks more. It is totally safe in the sense that it's just a skin deep procedure. So, and local anesthesia. So, no anesthesia risks really. Of course, it has to be done in a proper way. You just can't randomly poke needles. There are certain areas, certain ways of injecting anesthesia. There is a certain way of piercing the skin. Only then it becomes safe. Otherwise, of course, you have in the last 10 years, there are 3, 4 bad cases that have happened, and they were pretty much talked about in the media, and that's all because of wrong technique, similar to a dental procedure. So we have heard people dying after dental procedures also, but that's very, very rare. It's primarily gross bad luck or poor technique. So by and large, hair transplant is safe. It's not pain free, it's not painless, but it's less pain. Pain is not a deal breaker here. It's slightly, the procedure is very, very comfortable. But after that, for a week, you do feel a bit of heaviness, you do feel a bit of pain here at the back, wherever we have poked the needles, you do feel that soreness for a week or so. But that's about it. And that responds very well to simple painkillers like Combiflam. So pain is not a deal breaker here. Mild facial swelling can come if we don't take due care, but that also goes in 3 days. It does not have any impact on the brain. So that's the most common concern that people have, that I'm getting a surgery done on the head. More than patients is their parents, because they have not read so much about hair transplant on the internet like most of our patients do. So, surgery on the head, so brain will get damaged. We are nowhere near the brain. We are just in the skin. Then we have the skull, which is the hardest bone of our body, and it's not easy to pierce the skull. So no damage to the brain, memory loss, anything to do with the ears, eyes, nothing. No long-term headache, no chance of getting a migraine after that. First week, you have to take care, and that's it. And then it's just wait and watch. In about 9 months, 10 months, the hair grows very, very nicely.
Right. So I think the most important part is to go to the right person. Qualified dermatologist is where you need to go. Now, doctor, we have, talked about the problem mostly men face and how to treat that. Now, coming to women, I'm sure the treatments must be similar in many ways, but then the causes may be different. And as we all know that a lot of hormonal changes happens in women, which is comparatively more than men. So what are the major things related to hair that happens with women and how to treat them?
So female pattern hair loss is slightly different from male pattern hair loss. In male pattern hair loss, patients develop receding hairline and baldness. Whereas in female pattern hair loss is more of what we call a diffuse thinning. The hairline does not go back. And of course, not many of you have seen a bald female. So baldness does not happen, but the hair thins out. The amount that the split of the hair that gets broadened, the plait volume, the choti volume that becomes less. So overall, the hair volume becomes less, and that is a cause of concern. So here also the main thing is genetics. It runs in their family, and because of the little male hormone that's normal for a female body, that little male hormone causes hair thinning. But it's unlike in men, which is like 90% hormone dependent. In female pattern hair loss, things like nutrition, their menstrual cycle, the levels of iron in their diet, everything, their thyroid status, all these things play a role. So much so that in males, we hardly ever test, we hardly ever go for a blood test. But when a female comes to us with a hair loss issues and we are diagnosing female pattern hair loss, we do a battery of tests like thyroid, hemoglobin, ferritin, their hormone levels, because everything is playing a role, and that is why the treatment is also multifactorial. So particularly female pattern hair loss, we give special impetus to their diet, to their thyroid status, and particularly their iron levels, because many ladies have a low hemoglobin, low iron status, particularly in India where their dietary issues are there. Particularly in the vegetarian diet, there are not many many patients are deficient in iron. So these things have to be taken care of. PCOD, which is a polycystic ovarian disease, which is very common in ladies these days, that also plays a role. So that has to be ruled out. If that's there, that has to be treated. So it's a multifactorial approach in females. And also hair transplant is not a very good option in females. It's done as a last resort only. So we keep our patients mostly on medical hair loss treatment. And hair transplant is done in grade 3, a very advanced grade of hair thinning where the scalp is totally showing, or a lady who has a very broad forehead. So we do a forehead reduction surgery, which was a major surgery a few years back, but since a hair transplant has become so refined, so instead of cutting the skin, we just put some hair on their forehead, and that reduces the size of the forehead. So these are the two indications for hair transplant in a lady, but otherwise it's mostly medical hair loss treatment.
Fair enough. Now, doctor, we all know that nowadays nobody have virgin hairs. They have either colored their hairs or gone for some salon treatment, reboulding, combing, etc., etc., and they all involve a lot of chemicals. Now, how to take care of treated hairs? Plus, they do fall a lot, especially after these treatments. We tend to shed a lot of hair. So, what to do?
Yeah, so see, the ideal thing is not to tamper your hair. That's ideal. But of course, that's difficult. Being ideal is very difficult and sometimes to a point of being non-practical. So if you want to color your hair, it makes you look good. You want to a bit straighten. See, in straightening, I say that go for keratin, cystine, a bit of hair smoothing, but not rebonding. Rebonding is too harsh. But minor hair smoothing, using products like hair volumizing sprays, gels, waxes. This is absolutely cool if done once in a while. Because the good thing is that they do not tamper with your hair root. Whatever they're doing on the external hair shaft. And thus, it is not going to give you a very long lasting hair damage. It definitely damages the hair shaft that is being treated. But there are ways to limit the damage. First, of course, is to use good quality products and condition your hair. Conditioning means either use conditioners, serums, hair oil. My favorite is coconut oil, but any kind of hair oil that you like, keep using them, particularly before hair washes. After a hair wash, apply a serum, because when you condition your hair is less liable to break. So as you rightly said, after the treated hair, a hair which is too much blow dried, frequently colored, breaks very easily. So luckily, this is not happening from the root, but the hair shaft is breaking. So that can be prevented by conditioning the hair very regularly and having a good diet. And by this, you will be able to, by and large, protect your treated hair as well.
Okay. And what about dandruff, doctor? Because again, dandruff is a very common problem in our society. So, how to treat dandruff?
So dandruff is rightly implicated in hair loss. Again, it may not damage the hair root, but it does give us a reversible hair loss, which will come back, but hair loss does happen. So it must be controlled, because apart from hair loss, it's embarrassing to have it on when we are wearing black clothes. It does give you an itchy scalp, so it's be embarrassing and irritating as well. So home treatment works fairly well. Home treatment like lime, lemon, curd, egg yolk. These are good things to control your dandruff if you have mild dandruff. If you have severe dandruff, then you will see one of your doctors, your dermatologist, and things like medicated shampoos. If that does not work, medical lotions. If that does not work, tablets, antifungal tablet. This is the ladder: shampoo, lotions, tablets for dandruff treatment. So shampoos I can talk about here because they are available over the counter. So ketoconazole shampoos are the most frequently used for use in dandruff, which you can use 2 to 3 times in a week in the starting phase. The important thing is that how it is different from normal shampoo is that you have to leave it for 5 to 7 minutes. It has to act as a medicine, not just a soap. So apply it, leave it for 5 to 6 minutes, and then you rinse off. So that will control your dandruff. If ketoconazole shampoos are not working for you, then you will see a dermatologist or your doctor, and then they will prescribe you certain anti-dandruff lotions or tablets that will definitely treat your dandruff. One thing which is not possible is curing the dandruff forever, because these are fungal infections, just like any other infection, they keep coming back. So when it is severe, use a medical treatment and use a milder shampoo or home treatment for maintenance.
Okay. Doctor, any simple, basic hair care routine that we all can follow?
Yes, absolutely. So first of all, your diet. Diet is very important that you know, but hair care routine in general is that try to develop a habit of oiling your hair. I'm not saying oiling the scalp. That's not necessary. Oiling your hair, particularly ladies. Before shampoo, like say 15 to 20 minutes before shampoo, if you apply a thin coat of hair oil, that prevents overtly drying effect of your shampoo or your soap that you're using. So oiling your hair is good. Many dermatologists will not agree because our textbook says hair oil is useless. See, hair oil may be useless if you want to improve your hair root. So that's a myth that hair oil promotes hair growth. That's a myth. But hair oil is a good conditioning agent. And they're rightly said called hair oil, not scalp oil. So it has to be applied on the hair, and that protects your hair from overtly drying out. It conditions your bonds. Then there's a thing called cuticle. It conditions your cuticle, which protects the inner layer, the matrix of hair from your surrounding, from your harsh, your sunlight, your UV rays, your pollution, etc. Use a mild shampoo. Mild shampoo means a shampoo which is pH balanced, pH of 5.5, preferably sulfate and paraben free. So this is what we call a mild shampoo. So use a mild shampoo regularly. Many people are in a habit of, and they proudly say that I shampoo only once in a week. That's not right. You should shampoo at least twice, at least alternate days. And if you are very, very active, like you are gymming, you are into sports, or if you are sweating a lot, you can shampoo daily with a mild shampoo. That's absolutely okay to use. If you have overtly dry hair, use a conditioner after you shampoo, or use a leave-on hair serum, which you can just apply and leave it. After that, once you have shampooed, try to dry it using a towel or just let it dry. Using a blow drying is okay once in a while, but if you're doing it too frequently, it does damage the hair cuticle, the hair shaft, and which can lead to breakage. Try not to comb on wet hair. Let the hair get dry or semi-dry. Then comb it. It causes less breakage. And the comb that you're using should be a white toothed comb. Very fine comb, because of the pull, can of course cause breakage. The hair will grow, of course, but they'll take a long time to grow, particularly ladies, who need more length. So use a broad toothed comb. So this is the hair care routine that you can do, simple things to have better hair health.
Right, that was very informative. We'll pick some of our viewers' questions. So, Shahani Khan is here asking, so does hair fall more in rainy season?
It is. It is. So monsoons, particularly in North India, is a common season for hair loss, which is totally normal, and it comes back. And there are many, particularly ladies, who are more prone to this, that every monsoon they shed a lot of hair, but everything comes back, so not a reason to worry. Unfortunately, we do not know exactly why it happens, but that's how probably our hair cycle is tuned, that in that humid weather, the hair cycle goes in the telogen phase and we shed a lot of hair, but not a matter of concern because it comes back.
Right. Ranu Saxena is asking, sir, a lack of which vitamin causes hair loss?
So the most common is biotin, which is part of B complex, but that's not it. Vitamin A, vitamin D, C, E, any lack of these vitamins can cause hair loss. Other micronutrients like omega-3 fatty acids, essential fatty acid basically, and iron are particularly linked towards hair loss. And in general, protein. Many Indians, many of us have low protein in our diet, which is a huge contributory factor.
Right. So a balanced diet rich in protein and macro and micronutrients is what we need. We have Shweta Akhil Mehto asking, does our lifestyle increasing hair loss tendency?
Yes, absolutely. Lifestyle is directly linked towards hair loss. So common things are improper sleep, sleeping too less, or sleeping at irregular times. So we have seen that patients who have very irregular sleep cycle tend to have more hair loss, and they also correlate their hair loss since, for example, change of a job where their job needs night shifts, sometimes day shifts. So they experience more hair loss. Diet, as we have just discussed, smoking. Smoking is directly linked to hair loss. See, a person who has lovely thick hair may not have problems with smoking. But if you have a baseline hair issue, smoking even one cigarette in a day may contribute to hair loss. And rest of the your diet, your shampooing patterns, everything do play a role here.
A healthy lifestyle plays a very important role indeed in good hair. Now, doctor, before we wind up, any take-home message for our viewers?
Well, yes, because first of all, don't get obsessed with your hair. Many particular, and that is particularly for kids that I'm asking. Kids, when I say kids, means 18 to 22 years, because I'm seeing more and more patients who are getting totally obsessed with their hair loss, and they try everything. Before they come to a dermatologist, they try everything, anything that they see on social media, Facebook, everything, because world is filled with magic potions which hardly help. So don't get obsessed. Don't experiment too much, because your dermatologist is a well-educated person who has spent 5 to 6 years reading about hair loss issues, and most of your hair loss, most of the hair loss causes are treatable, if not curable. They are totally manageable, and so don't obsess, don't get depressed over it. You seek experts' help, and your hair health will be restored. Right from dietary changes to a hair transplant, we have n number of things which will help you at various levels, at various severity of hair loss. So no reason to lose sleep on hair loss.
Right. That was very nice of you, doctor. And I'm sure it's not necessary to take or get overstressed because of hair loss. What we can do is to go and consult a qualified dermatologist like you. And as you said, there are so many ways to actually, bring back your hair. And if nothing works out, then it's okay to, we all are individual and we all are anyways beautiful. And then you have so many options to go for. Thank you so very much, Dr. Gaurang Krishna, for your valuable guidance and your time. So it was wonderful talking to you.
Thank you so much, Sanjukta. Thank you for having me here. It was a pleasure interacting with you.
It was a pleasure for us as well. And I'm sure your guidance will help our viewers. And viewers, if you want to get personal consultation from Dr. Gaurang Krishna, you can visit Facebook, Instagram account by the name MedLinks Trichology. A big thank you to our viewers as well for watching this session. And for more information on how to get all your hair issues resolved, do like and subscribe to our YouTube channel, Hair All Issues Resolved. Thank you, Dr. Gaurang, once again.